Hi, everybody. Thank you all so much for joining us today for the kickoff, MBQIP Open Call kickoff. We are so grateful that you're able to join us and really, really nice to see you. We took a little bit of a break, a few months break, but now we are back on. So it's really good to see everybody. So a little bit of a agenda, kind of what the objectives are for our call today. So just everybody, I hope you're all having a great fall season, although now it's looking like more like a winter season. We are getting a lot of snow here in the Twin Cities, and it sounds like it's pretty much the same across the state. So we hope you're all keeping warm and safe during this time. So our agenda for today, so we have a couple of updates. One is around MBQIP data reports. So Robin Carlson will be talking about that. She'll also be giving an update on data submission for HCP IMM 3 measure, the influenza, healthcare worker influenza measure. We are also pleased to have a guest speaker today, Emma Distel. She's the State Flex Coordinator from the Minnesota Department of Health, Office of Rural Health and Policy. Emma is just kind of going to go over the program, what the Flex program is, how MBQIP fits into that. So we are really grateful that Emma is able to join us today. And then we will look at the program plan. So the Flex QI program plan for the 2022-2023 years. So we'll talk about what we are going to be working on with you starting today through August of next year. And then we're going to talk a little bit about the EDTC project that we conducted last year with 10 pilot sites. So we want to share some learnings from that project with you today. And then we will wrap up. So again, Stratus Health project team here. Again, we welcome you all. The team has not changed. So I am the program manager. Robin Carlson is our quality reporting specialist. And then Jody Winter is our executive assistant. So we are all here to work with you. So updates. So Robin, I will turn it over to you to talk about updates.
Hi, everyone. Just let me go back for a minute. And when Sekit kind of said something about this being the kickoff, and maybe you guys aren't confused, and it might just be me, but just to remind everybody that the MBQIP program, the program year goes from September to the end of August. So, even though we're not at the end of the year yet, and we're kind of talking about this as being, if you hear somebody mention about this being like the start, or what we're going to do for this year, whatever. Just to kind of remind everybody that the program runs from September to August. So, and again, maybe I'm the only one who sometimes gets confused, but I have to remind myself. So I thought I would just remind you guys as well.
Perfect.
So if you could do the slide back, just kind of an update on the reports. They've been delayed. Oftentimes they're supposed to come out quarterly, and maybe there's always a lag time, because the data that you submit, the outpatient data, any data that you submit to like CMS or NHSN, that data goes to them, and then it gets to the FMT, the office who does the reports. There's always some lag time until you get them, but this time there's a little bit more lag time than usual. The EDTC reports, which usually aren't late, those just came out, I think, the beginning of this week from Jody. So please look for those. They were a little bit later this time because there were some difficulties with getting the data from FOHP. Some of the states turned in their data. There were some errors, so that delayed those. The outpatient reports and your reports regarding, HCP, those we believe they're coming out at the end of this week, beginning of next week. That's the latest that we've heard. Those have been delayed because of from getting the data from CMS. CMS has got a new contractor who works on the data. And that contractor it's just kind of like starting over, getting that contractor to realize who at F4HP gets that data. And there's been some issues around what they sent. So we think that's finally cleared up. And again, hope that your MBQIP reports for the outpatient data and HCP, those will be coming the end of this week or the beginning of next week. And if you're not sure how, again, Jody, correct me if I'm wrong, but I think the EDTC just went out this week. If there's any questions about how to get access or how to find your reports, you can email Jody or myself or Senka, and we'll send you to Jody. Data submission, just a reminder, okay? It's not like don't be panicking and think that you've got to enter data for the healthcare personnel influenza vaccination yet. But it is the flu season, as we all know. I want to remind everybody again, we always call it HCP. That's pretty much how you're going to see it in the specifications manual, and you're going to see it as healthcare personnel influenza vaccination and NHSN. The reason we have IMM3 on there is that is how the data gets out on Care Compare. On the Care Compare public site, they list it as IMM3. So that's why we've got that there. But it's all the same measure. It's all the same. It's just the one data collection. But we just want to say, flu season is starting now. It is still a measure, just because you may be recording and reporting on COVID vaccination for your staff. This one has not gone away. It still is a measure. Flu is just as important, if not more than usual. So just a reminder to start thinking about and don't forget about that data collection. Again, it isn't going to be due in NHSN until May of next year, because you can wait until the due date, till the flu season's over, to enter that data. But just a reminder to start collecting it. Maybe you've got turnover in staff and maybe you need to set someone up in NHSN, a new person. Or maybe someone's left and you're not sure who's even doing this. Now is the time to get set up and get someone established in NHSN if you don't have it. And then we've got a couple links there to resources on the NHSN site on how to get new staff in NHSN. Okay, I'm pretty sure every hospital is already enrolled, so it might just be about updating your staff. So there are some links there on how to do that. And you will be hearing much more from us about this when it gets closer to the due date for entry, which again is going to be in May of 2023. And just a reminder that NHSN lets you start entering this data as soon as you want. You can enter it monthly if you want. You don't have to wait. But the due date has to be hit for the data to count for MBQIP program and for those reports, okay? And then just one final reminder, maybe you're submitting healthcare personnel influenza vaccination data to somewhere else. Maybe I'm not positive if the state still requires you to enter that, or you're entering it for somewhere else, and that's all fine, but that does not take the place of entering it into NHSN for this program. Okay, to meet the requirement for the MBQIP data submission, it's entering it into NHSN. Anybody have any questions around that? You can put it in the chat if you don't want to unmute yourself, or you guys know how to get a hold of me if you have any questions.
Perfect. Thank you, Robin. And also a reminder that we will be posting these slides and the recording from today's meeting on our website. So all of those links will be in those slides. So no need to jot down any notes. We will be posting as this. So the next up is Emma Distel, the State Flex Coordinator. So before we kind of get into here's what we are going to do for this program year, as Robin said, September 2022 through August 2023. Emma is going to orientate us first to the state flex programs, what it is, what the role of the program is, how the program is supporting the critical access hospitals, and answer any questions that you may have. So Emma, I will turn it over to you now.
Thank you. Good morning. I am putting my email in the chat just so that it's there in case anybody at some point in time would like to contact me. So I am here to talk about what or who Flex is. The state Flex program sits within the Office of Rural Health and Primary Care, which is Minnesota's State Office of Rural Health. And I think, Senka, you could probably just go right to the next slide. Yeah, that works. And so we're within the State Office of Rural Health, which is where all Flex programs sit across the country. We're at the Minnesota Department of Health. The Flex program was originally created in the late 90s, early 2000s, when the critical access hospital designation was created. So in the conditions of participation, the Medicare COPs states that have a Flex program can have critical access hospitals. If there's not a state Flex program, there cannot be critical access hospitals. So the goal of the Flex program is to kind of support that process of becoming critical access, and then once a hospital is critical access, supporting with programs and initiatives for sustainability. Most of Minnesota's hospitals have already converted, so we don't really focus a lot of our time on that. We're more of a program support and working on kind of things that are relevant to critical access hospitals. FRHP provides us a work plan. That's where we get the Flex grant through. Minnesota specifically works on quality and patient safety, critical access hospital finance and operations, critical access hospital population health, and then rural emergency medical services. And while most of our work is focused kind of on the hospital as that central hub of rural health, we do try and scope our stuff to the rural community more broadly as well. So that's where the population health and EMS pieces come into our work plan. I think Robin had already mentioned this earlier, but our projects that we get from FRHP and that are given out to our subcontractors are on a September through August timeline. So all of the Flex work is not a calendar year. It's not a fiscal year. It's September through August. And that is just because that's how the federal office